Hi, I'm Alan Magruder. I'm a graduate of the Spine Rehab program at the University of Iowa. I've had a bad back for a long time, a lot of low back pain and a lot of immobility in my back. The problem turned out to be fusion in the middle of my back, spontaneous fusion, not surgical fusion, called DISH. I had some other health issues that really slowed me down, more sedentary, which means that my core got less strong. I gained a little weight and it aggravated the compression in my low back, to the point that it was difficult to stand, to walk for any length of time, to do work in the shop or to do any work around the house. And I didn't want to do a procedure, if there was one, if I could even find a physician that would be willing to do it. I didn't really want to do injections or to lean on pain medication. So I knew that left me some form of rehab therapy and behavior modification. So I was shopping for someplace where I could immerse myself in a program where there was plenty of support, a lot of education, and people to hold me accountable to it. It's a big deal to commit 2 weeks, 8 hours a day to what you know from the outset is going to be essentially boot camp for back pain. The crew in the spine rehab program will tell you right away, you're not here to get a pill. You're not here to get guaranteed that at the end of 2 weeks you're going to be free of pain. You're going to be moving your body a lot. You're going to be finding the limit and range of motion and strength and endurance physically that you can do. Dr. Kafala, Dr. Chen, Pam Lee, and Deb Parrott, these guys have been doing it, as far as I know, since the 80s. So you can't come in with a problem they haven't seen. You can't come in with a difficulty that they can't help you work through or find a way around. And they are always available, and we always have structured time together and structured one-on-one time. I'm really lucky because the work that I've done in strengthening my core and my lower body has relieved a lot of discomfort in my low back, so that now I can pick things up when I drop them. And when I want to come work in the shop, I can stand on my feet for more than 3 to 5 minutes at a time before I have to take a break. I know that it seems trivial, but a huge victory is to be able to reach around behind me and tie my apron on when I want to work in the shop without having to go in and find somebody else in the house to tie a bow for me. Since coming out of spine rehab, I made sure that I have sort of a structure that I stick to. I do it in 1 month segments. I have a physical thing and I have a relaxation practice. And I'll alter them just a little bit to keep them interesting. I focus on my lower body because that's where the money is for my pain. So I'll run stairs, I'll do squats, I'll do bike works, things like that. And then for relaxation and pain management, I've developed for the first time, though I've tried meditation before in the past, an actual meditation practice. And this is a huge deal in managing stress, which has a huge impact on inflammation and how my back feels and how I'm able to move. I recommend it for anybody that I talk to that has back pain, and there are a lot of people. Thanks to that program and the work that I've done there, my back pain is much, much less. I have greater range of motion and I'm able to get around and enjoy life a lot more than I was for the years leading up to this.